you're on.
Okay. Well, welcome this evening. I always enjoy these presentations. I'm sad tonight because it'll be the last one we do, at least for the foreseeable future. And I want to thank you for coming out on what looks like a beautiful night after some stormy weather. So thank you for doing that. And I have to say, all of you are the reasons we're here. You are among the greatest audiences in the world. You bring the best questions. Your knowledge is incomparable. And so I do welcome your questions. This isn't Stump the Presenter night, but I do welcome your thoughts. And if I don't know, I'll get back to you. And so I'm going to violate Devona's, don't share a personal story tonight. I'm just going to say it up front, because this is an interesting anniversary night of sorts for me, because it is 4 years ago, and I may get emotional. 4 years ago tonight, I had a stroke. And I am lucky to be back here, I've been here, but that I'm here. I'm thrilled to be here. So this makes me somewhat of an expert on brain health. So that's why this topic is in here. But I've also explored it in bigger, broader ways since then. So let's go ahead and start on the topic. We have a lot to cover. So to try to get you out of here before midnight, we'll definitely do that. But I want to start by saying, was there anything in particular, especially the new people, maybe don't know how we present, was there anything that you were coming to find out about or specifically wanted to be sure was covered in any of these topics? Go ahead and feel free to let me know if there's anything. Yes, ma'am.
I have a lot of friends that are older that have prostate problems.
Okay.
I don't know if that's going to be covered. And do hormones, bioidenticals, work with prostate?
Okay. What I can say, so the question was, friends that have prostate, were we going to cover it? I'm probably not specifically going to cover, situations like that. But I can say right up front that, yes, bioidentical hormones are helpful. And so when I get there, when we're talking about men, we'll address that. Anyone else? Yes, sir.
Will you be discussing telomeres in any way?
Telomeres, okay, is the question. So you mean in terms of, let's say, brain health and senescence? No, I hadn't really planned to go into telomeres too, but I will say they play a big role in longevity and things that turn them off and the things that turn them back on. So it is significant, but probably a little bit beyond the discussion. But we can, when we get there, if you want to bring them up, that's okay. Any other comments or things that you wanted or hoped I would cover here tonight? So I'm hoping I don't have too basic of a presentation. So let's see, because they're pretty good in terms of what you mentioned. So so let me go ahead and forward things. I feel like I have too many things to hang on to right at the moment. And so Devona, I just press this part, right? Yeah. To go forward. Okay. Actually, that's not working. So I wanted to start out with this one. Why are we all so tired? When people come in to see me, it's the most common topic that comes up in the appointments. So, I see it in everyday life. I see it on the road. We see it involving different things that are occurring in our community. So is it just that we're tired, or is there something else going on? And in particular, is there something else going on for each individual? I won't say that every cause of fatigue and malaise is the same. In fact, it can be very different for individuals. So I invite you in terms of thinking about other people or in just assessing what's going on, to ask yourself, is there something else going on that is contributing to these symptoms? We are going to be talking about adrenals and thyroid, very commonly associated with fatigue. But what's also true is aspects of brain health and in fact, hormones play a big role. I have many patients who, that I put on bioidentical hormone therapy, and they report an improvement in energy. specifically when we're talking about those that are for that purpose, let's say DHEA, testosterone, or that help in those ways. So what's also interesting in terms of hormones and thyroid and adrenals is that a deficiency in one area can contribute to a problem in another. So let's say you feel like your thyroid is adequately balanced. However, and I see this happen often, is what can happen is if you overly, focus on thyroid, you can actually drive your adrenals into exhaustion. So when you treat, if you're not working with a doctor that's looking at both, you're not really getting the optimum approach that you need. It doesn't mean that's true, but it's often the case because they depend on each other. I often refer to them as being yoked together. They're a system, and they're part of the same system. Well, it doesn't want to advance. We moved the table around so I could see it, and now it doesn't want to participate. So how do you begin to assess what's going on in any one of these areas? And this is where I say start to do your own track down if things are related to you in general, or let's say a significant other or a friend, or it can begin anywhere. But what are the symptoms that you're reporting? And don't be shy about saying something. I often will encourage a patient during a consult, well, is there anything more, hopefully before we get to the end of the consult. And yes, they'll say, by the way, this. And sometimes people will be a little embarrassed to say it, or I don't think it's much. And sometimes what happens is it's really the bottom of the tip of an iceberg. It's really a big issue. And that's not always a doctor's favorite thing, is you're going out the door to bring up a really big topic. It can be awkward to getting things done, but at least it begins to open up the discussion. So I would say maybe in terms of brain health, other things, have others noticed a problem? I do a lot with hearing loss and aldosterone therapy, and sometimes it isn't the individual that knows they have a problem, it's somebody else that notices it. So have others mentioned something? Do you notice a change, let's say, in how you look, how you feel, how you interact with others? Are you becoming more angry? For example, I'll give you we often talk about as people come in, kind of noticing how they are. There's an expression sometimes you hear called the grumpy grandpa. What grumpy grandpa is usually, not always, but it's often a man that's low in testosterone. So sometimes low testosterone in men will manifest as anger or inability to cope. And I'm not saying always, and I'm not saying if you have a grumpy grandpa, that's why. I'm just kind of saying that is a symptom sometimes we see. For example, are you losing the outer third of your eyebrows? Hair loss like that. I'm not speaking of hair loss, let's say, on the legs, but eyebrows can be low thyroid, for example. Are you having hot flashes and night sweats? Women particularly, but we will see it in men too. It will sometimes happen. Is it hard to wake up in the morning? Or are you having a slump in the afternoon? Differences there. So morning, probably thyroid. Afternoon, maybe adrenals. Do you have mood changes? Are you noticing that you're not coping well? Is your thinking affected? I had a patient the other day, and she was noticing, even though she felt okay, but she was having trouble thinking. So you will see brain fog, mood changes with every one of these things that we're talking about, from thyroid and adrenal function to hormones to brain health. So you will see these, and so they similar symptoms, different causes. So how do you determine, how do you determine, in fact, where to start? And so I want to start with hormones because it's a big topic. But I want to say that everything I'm talking about tonight, everything, in fact, everything you've done from birth till now has been a program for brain health, everything. So, and what research is finding, and I'm going to allude to this research study a little bit later. It's called a reversal of cognitive decline, a novel therapeutic program. And I'll just tell you now that 9 out of 10 patients who are put on this program experienced an improvement in their brain health. But am I going to say that there's this nifty drug, or that it was because they exercised, 40 hours a week? Or I'm not going to tell you something like that. I'm going to say that, and in fact you have a handout there, that everything we're talking about is relevant to brain health. And that's what this particular study did with 10 people, 9 of whom improved. They implemented things that holistic medicine has been studying and identifying for years. So everything I'm going to talk going forward here is related to what we're going to end with, which is brain health. So hormones, how do they play in this particular scenario? They do. Now, I didn't write it here, but hormones are part of this particular picture. And then depending on how old you are at the time you start hormones, it may affect how they're given to you. So you may not realize this, but Dr. Wright is considered the father of modern bioidentical hormone therapy. He didn't invent hormones. He didn't invent the process of giving them. He did work with Kripps Pharmacy up in Vancouver, BC, and he did come up with a bioidentical approach to hormone therapy. And as the story goes, Dr. Wright will tell it himself this way. A woman came in, and Dr. Wright, and she wanted hormones, so he pulled out his prescription pad and started to write a prescription for Premarin. You may not know that Premarin, which was the common estrogen hormone that was given to women at the time, and the name means pregnant horse's urine, pregnant mare's urine, Premarin. And it's derived from horses. So she said, no, wait. I don't want horse's urine. I want something for me. So he had to sit back and think about that for a while. And so he worked with this particular pharmacist, and they came up with the first hormone, bioidentical hormone called Tri-est. It was derived from the Mexican yam. And it's not a patent medicine, meaning it's identical to our hormones, and we derive all of the relevant hormones from this, and it only needs one step to convert it from the yam to a product that you can use. So we have since gone away from using Tri-est so much for a number of reasons. We're using more Biest, and Biest, it means 2 estrogens. Tri-est means 3 estrogens. What I also like about Biest is also bioidentical. That's what I derive out of there too. So when we're talking bioidentical, we're also talking about not only is the molecule closest to your own, but it's also following nature. So for example, in women aren't really designed to have hormones given to them after menopause. But as we live longer, we age more effectively. And you can even see it if you look back at pictures of people in comparable age groups. You will see that people are aging better now. A lot of that has to do with different therapies that are available. But at the same time, some of these therapies are actually helping people to age better, and by the same token, then improve in other ways. So bioidentical, meaning we copy nature's intention. And for women, for example, that means we give them over the course of a certain number of days, and then we withhold hormone. In terms of men don't have a cycle per se, but we do also want to make sure that we don't suppress the natural testosterone production that a man might have, especially if he still wants to have children and have a family. So I know I came into this really quickly. Any questions so far on where I'm going with this, or things you may want to know more about? Yes, ma'am.
Is aldosterone still the only place you can get it? Is Vancouver or?
Oh, That's a good question. Let me clarify. So the question was, is Vancouver the only place you can still get these things? The answer is no. What's happened since then is that almost every compounding pharmacy in the country has been able to produce the hormones, Biest, Tri-est, testosterone, except for aldosterone. So aldosterone is and I've worked with this a lot since 2009, did the aldosterone studies for hearing loss. We had tremendous improvement in a certain group of people. So aldosterone used to cost about $750 a month. And so when Dr. Wright was working with this, I know you're looking astounded there, but he was working with people at the time who could afford it. So what I'm speaking of as aldosterone is the way it can work to help support hearing is it helps improve the flow of sodium into the inner ear and the flow of potassium out of the inner ear. Now what happens is in the process it seems to improve the signal to the hearing centers of the brain. Aldosterone also has an impact on blood pressure as well, affecting what we call the renin-angiotensin system. So it can raise blood pressure, but it also seems to have this other effect. And so we started the study based on being able to get this from a pharmacy in Madison, Wisconsin. Now, I won't go into some of the political ramifications, but a certain agency called the FDA has had a big impact on a lot of things and will continue for a long time. And so they have made the access to some of the ingredients needed for this production very difficult to get. So we have got it available to us, and I will say where, because there aren't many places you can get it reasonably. Key Pharmacy. So that's just down in Federal Way. So if you want to get it reasonably, you can get it at other pharmacies that can make this, but the costs are very expensive. So yes, we're not just restricted to Kripps Pharmacy. Compounding pharmacies across the country can make almost all of these hormones, with the exception of aldosterone. Some of them can't do it in a cost-effective way. But it still remains a very good approach to hearing loss, and I still prescribe it for people that fit the criterion for it. Very good question, though. So I thought I saw another question. Yes, ma'am.
Is Biest made from yam or derived from yam also?
Yeah, so the question is Biest derived from yam? And yes, all of what we call bioidentical is derived, at least what we get from compounding pharmacies. I'm not going to generalize that to all conventionally provided bioidenticals. I don't know for a fact, but I do know that everything that we do through compounding pharmacies and prepare is. Well, we don't prepare anything on site, but licensed compounding pharmacies, correct. So moving on to the next slide. Oh, you already did. Okay. I'm sorry? Yes. Next one. So what are the benefits? And I did speak of some of the benefits earlier. Anti-aging. So this is commonly where people speak of anti-aging, although I would say supplementation, use of creams, all kinds of things, exercise programs are anti-aging. In many cases, especially for women, the improvement in the skin, the reduction of wrinkles, prevention of osteoporosis, and this is a big one. And a colleague was asking me about it recently. We absolutely see improvement in bone health, especially in women, using hormones and some of the bone health cofactors, things like boron, manganese, vitamin D, vitamin K. I have people that I have DEXA scans on, and when I'm not talking young women, I'm speaking of women in the age group where they have fracture risk, and I do plan to write about some of these cases. I have actually had people improve in their bone health. Osteoporosis is also a problem for men, probably more so than it's been in a long time, because of things like proton pump inhibitors, things that reduce stomach acid. You need stomach acid to be able to absorb calcium to break down many different nutrients. So we see more osteoporosis also showing up in men as a result. But bioidentical hormone therapies, both estrogen and testosterone, are helpful in improving bone strength. The stroke and cardiovascular risk reduction, the reasons are that many of the hormones actually help support smooth muscle. They help improve vascular integrity. So that's how they can help improve in this area. It seems obvious strength and endurance in both men and women. Yet I have talked to men in particular who didn't realize over time that their strength was actually diminishing. And so when we started talking about it and they realized that they were having a problem, then it became clear that adding in testosterone would be significant. Now, I don't just take patient report. I do testing as well. We see what the levels are. Obviously, reducing symptoms of menopause in women. There are many different symptoms from, let's say osteoporosis, poor sleep, hot flashes, night sweats. Hot flashes is a reference to vasomotor or heat, sudden heat surges during the day, night sweats during the night. It helps improve sleep for many people, progesterone in particular, and improving energy and mood. So a lot of good reason for using hormones. So, and this also kind of taking off on the previous, what symptoms would suggest, and this is again doing your list if you're interested in this. Do you have hot sweats, hot flashes, night sweats? Are you having trouble sleeping? Are there mood swings, depression? In particular in women, one sign of low hormones is also frequent urinary tract infections and incontinence. And part of the reason is that the hormone levels drop in the vaginal tissues, and so that increases let's say that there is a vaginal atrophy or dryness, which then allows bacteria to penetrate the urethra and the bladder more quickly. For men, reduced stamina and strength. Let's say you do work out, but you're not building muscle to the degree that you would like. Mood swings, like I mentioned, the grumpy grandpa, sort of more anger or even passivity I've seen. Low libido, that one seems pretty obvious, but it's not always to everybody. Having BPH or symptoms of poor urinary flow. Prostate, this is where the prostate comes in as well. So the prostate, I heard of, not sure if it was Dr. Wright or a colleague or at a continuing education seminar, that someone said basically the prostate is a very poor design in men. He said it's designed to actually grow your entire life, so it expands, and you have this tube going right through it. So what can happen except squeezing that tube, the urethra going right through? So poor design, and so it's not surprising that many men develop BPH and have difficulty, but testosterone can actually help in that circumstance. Now, I'm not going to say that's the only thing to do. There are different supplements to add in, different causes to look at. But it is an important factor. And let's go to the next one. So how do you assess the need for hormones? How do you determine? So when people come in, I do take a very thorough history. I want to know what the symptoms are when they started. With women, it's pretty clear if we're talking menopause. It's the definition of menopause is you have not had a cycle for 1 full year. But it also is measuring FSH and LH and seeing that the numbers are too high for you to still have ovulation in the first place. So, but it's not always clear. I would say for every individual, every hormone therapy, it's totally unique what comes in and what people talk about and describe as a problem. Dr. Wright did actually develop a 24-hour urinary hormone profile. And we are in this section is the Meridian Valley Laboratory, and they actually are the laboratory that does look at these and many other types of tests as well. And so what we like about it, and over the years I've done this, looking at blood versus the 24-hour urine, I can see a clear advantage to assessing hormones with it. So 24-hour literally means you collect all urine for a full 24 hours. It's resulted out, and then we get values. And I think I gave you guys a pathway. I believe it's there in your packet. It's a complicated thing that comes down from cholesterol. I think it's in the extra one that they handed out separately. And so it's the hormone pathway. Everything comes from cholesterol, by the way. So hormones, your endogenous levels are created from cholesterol. And then so we're all on steroids. That's the steroid hormone. And so essentially then, that whole pathway is what we look at and result out to see where your hormones are, where the deficiencies are. So it's far more effective at evaluating hormones than blood testing, which is one point in time. And the question is, what point in time is the right one? So is it for a young woman? You know, I've heard various people say, no, it's day 3 or it's day 6. At what time of day? 2 o'clock? Midnight? So this will collect at a specific point in time all of the urine. So yes, you could say it's a collective, but it's phenomenally helpful in directing doctors like me in how to prescribe hormones. What's really nice, too, is it's collecting free levels. So when you're doing in the blood, let's say for testosterone, you're not getting free hormone, and the body can only use that which is free. In blood, testosterone, for example, is bound to sex hormone binding globulin. And the amount of that will determine how much is bioavailable to men. So, for example, we will get a testosterone free level in the urine, and that can tell me what your effective level of testosterone is. And then I get the urinary metabolites. I can see what the metabolites are doing, where they're going. So to me, looking at this is far more effective for men and women than looking at any blood testing. The blood testing, too, is really not only one point in time, but it's very affected by when you just use the hormones. And I've had a lot of people come in that have been given either way too much or way too little hormone based on just blood testing. And it's an interesting thing that happens with testosterone. And we've actually told not only men who are on testosterone, but people with thyroid, to, if you use it on the day of a blood test, let's say, you apply it and then do not have a test any sooner than 4 hours later. Many people get given prescriptions that are not appropriate because they applied at 1 hour, went in the next hour, and it looks gigantically high in the blood. That's a peak level. It's not your effective dose. The same thing happens with thyroid. If you take your thyroid, let's say at 7 in the morning, you go in and have a blood test at 8, it's going to get your peak level, not your effective dose. Now, I do believe in thyroid testing in the blood. It's far more effective in my mind. So basically it says 24-hour urine is probably the best way to go. We're going to evaluate your health status. I'm going to ask you about health factors like risk of blood clotting, cancer in the family, prostate issues, risks of prostate cancer. And in men, we are definitely going to measure the PSA. PSA stands for prostate-specific antigen. Now, in some areas, it's been discredited as a test. We look at it, though, for the velocity of change, because you don't want to add hormone in if somebody has an active cancer anywhere in the body. It's just a good rule of thumb. Don't add it in. Yes, ma'am.
Is blood clotting a bad thing?
So the question is blood clotting a bad thing? Say more. Is there a specific type of thing you're thinking of?
Well, like when I was having menstrual cycles.
Okay.
I would
Okay.
get clots of blood coming.
Okay, I'm glad I asked you. So the question is, let's say having cycles and you're getting blood clots, is that bad? That's actually a different scenario. So what's happening in that case, the estrogens have dropped at the end of a certain period of time, so they drop, and that's what signals a period to come. So the spiral arteries in the uterus break off. And so that can break off and release blood of different sizes, clots kind of thing. So no, that's not the kind of thing I'm speaking of. What I'm speaking of is blood clotting that might be your risk of stroke, your risk of, let's say, people with atrial fib. There's some of the reason they are given anticoagulants is because they can get a clot. So if you are a person who has a higher risk, then some forms of hormones are not a good idea. Birth control pills, for example, can increase your risk of clotting. Testosterone can actually raise hematocrit in men and red blood cells, so we have to watch those values. So I'm going to be monitoring their blood for those things. Does that answer the question? But yes, any kind of, let's say, blood clotting trait, I would say I would want to evaluate before giving hormones to someone as well. Any other questions on that topic? So knowing your current health status, symptoms, very important for what we're going to go ahead and do. So I want to cover kind of specifically, but I'll do this quickly because we did mention hormones for women. Generally, there are 3 types of estrogen. You might see them listed as E1, E2, E3, Estrone, Estradiol, Estriol. There are other forms. These are just the most common and the ones that end up in prescriptions. Progesterone is very important for women, especially if they have a uterus. If someone has had a hysterectomy, less so. But we believe in this clinic that we should give progesterone to women even when they don't have a uterus, because every cell in the body has a receptor for progesterone. And progesterone is, for some women, magic for sleep. I've seen women not be able to sleep. I give progesterone, and suddenly they are able to sleep again. Progesterone can often be given to men, too. I've done it very little, but it is indicated. Pregnenolone is probably the newest hormone on the block. It does help with word retrieval, and anyone in menopause probably knows what I'm talking about. The word doesn't come like, I think I can see it, but I don't know what that is. So that helps in that particular situation. We don't handle androgens very well, but not as well as men, and in much smaller doses. So DHEA and testosterone are very helpful. And growth hormone, I'll just clarify, growth hormone is really one of the longevity hormones. It's really important, but again, the FDA has made it really hard for some types of practitioners to give it, and in certain circumstances only. Yes, sir?
Specifically, growth hormone, what is it?
So growth hormone is one of those hormones that's produced at night when you're sleeping. And so, in fact, if you don't sleep well, growth hormone might be very low.
What's the name of it?
Human growth hormone?
That's all. HGH.
Okay. Yeah, HGH. Yeah, sorry, I should have put the human part there. So mostly what we do to help support it is actually by giving amino acid supplementation. So right now, I don't give growth hormone as a prescription to anyone, although there are people that do. It's sort of like, it's like if you have a home-based business and you turn in your taxes, it becomes a red flag for the government to look at you. Growth hormone prescriptions are a little bit like that. So most of us do not give it unless there's a good reason, let's say short stature or in children or something like that. And for the next one. So for hormones for men, I think it's very important for men. It does help with mood, with mental health, with muscle strength, bone health, as I mentioned. Because testosterone does actually work a lot, a focus on muscle mass, it's really good for cardiovascular health. As I said, it's harder to detect the reasons in men, but that's why we do the interview, we talk about what's going on, and then we test. And if it comes back, testosterone is low, then I usually will do a therapeutic trial with it and see what then, after testing, what comes back after that. It's important, though, that the PSA not increase, that there isn't any reason to suspect cancer, that nothing gets worse. Sometimes slow wound healing will also indicate a need for testosterone. And I use testosterone a lot for women in terms of, let's say, improving vaginal atrophy. So, and yes, ma'am.
If a man has had their prostate removed at some point, would they ever be able to take testosterone bioidentically?
So the question is, if a man has had the prostate removed, could they use bioidentical testosterone? I guess it would depend what the numbers come back. You mean what was it,
like
due to cancer? I guess it would be in the same thing as, let's say, somebody who had an early hysterectomy. We'd measure and see, evaluate the symptoms, evaluate the cause. I don't see a reason not to. Again, not in the case of an active cancer. And let me explain. There is a gentleman who is a Harvard professor, Abraham Morgentaler, who wrote Testosterone for Life. And he actually advocates for testosterone even with prostate cancer. So I'm giving you some of the conservative view here, but Morgentaler would probably say absolutely in those circumstances. He believes that we have the wrong approach to it. Because if too much testosterone was the cause, he says, then 20-year-olds would have cancer, and they don't. So it's something to think about. But so long as there's a conventional approach or standard of care, it becomes a risk to go against that. It's something holistic practitioners have to weigh all the time. So sometimes you'll get a no from someone, and it isn't because in their heart of hearts they don't think that it's a good idea. They just can't go there. That's like with growth hormone. I can't go down that road, even though I've seen benefit with it and think it's justified in many cases. So a typical dose of testosterone for men, 25 to 100 milligrams per day. I am telling you about the way I use it, and topically. I get very worried in some cases about pellets and injections, because I've had people come in and they are reporting levels that are sky high. So you think, okay, it's going to dissipate, but sometimes it doesn't in those circumstances. I always add in some degree of DHEA because it's a precursor. And so it also is a good adrenal support, and men have both in high amounts, testosterone and DHEA. And as I said, the other ones to add in as well. Any questions on any of that so far? Do you need some water? Okay. I'm going to say that it's a safer approach to some of the conventional strategies, the bioidentical hormone therapy. But that's based on studies. I didn't include any reference to a study here, but there are studies that show this. A follow-up is needed. I mentioned the different types of follow-up that are important. And then I believe absolutely in annual testing and seeing your doctor just to make sure nothing changed. Any questions on that part of the hormones so far? I know it's probably on the general side, but I wanted to give you a basic overview, and if there's anything specific, I'm happy to go into that now. Yes, sir?
Do you have any position on the question of types of athletics or exercise that has an impact, particularly in the growth hormone side of it? That one way to increase your growth hormone is through
Exercise. So the question was on opinions related to ways to increase human growth hormone, including through exercise. And yes, you're absolutely right. The other ways that work too are using amino acid therapy. Ornithine, glutamine are two of the ones to use, arginine. Getting a good night's sleep. Zinc balanced with copper, which helps raise testosterone, which helps raise human growth hormone. That's another way to do it. In fact, if you're going to do any kind of hormone testing and you've done a lot of exercise, you want to be careful because that can actually skew some of your results too. Let's say a PSA test, for example. So yes, I do believe in those. Acetylglutathione also helps raise human growth hormone. We, in fact, did a test in the office between a human growth hormone supplement that was available and the acetylglutathione. And what we found was it worked pretty well. But some of those amino acid supports that worked very well, like were available from Life Extension, are no longer available. That's how difficult some of these things are getting. So yes, those methods are some of the ones. It's almost like we're kind of going backwards in terms of natural medicine, in terms of what we can use to raise some of these things. But acetyl-L-glutathione is helpful. And some of those other methods work very well too. I've seen the methods, I've seen them come up, but also a good night's sleep is very helpful in raising growth hormone. If you're talking about something that's perpetually low and has been low, that might be something to investigate a little bit further. There could be an issue with that, and that is sometimes the reason for adding in human growth hormone. Very expensive, but when it's indicated, it should be used. So,
specific to this question, I think
yes,
you started
sir.
by asking about there's certain types of exercise.
Oh, okay, what's that?
I think, isn't strength building supposed to be the best?
So the comment, yes, I would say strength would be the way, but I also believe that any type of exercise will help support it. I've seen that because patient report again, I'll see it in the labs that come in, and then I'll ask them, what were you doing before, and then they'll tell me. So, but yes, a combination of strength as well as endurance as well as cardiovascular I think would be good. But don't forget about the natural supplements that do that as well. So if you want to go ahead and... So I want to switch topics here for a minute. You know, where do you start? Is it the thyroid or is it the adrenals? And I have to say, maybe it's just because I'm in this building and this is what I see all day long. I feel like we almost have an epidemic related to low thyroid, especially in menopausal women. But I think adrenal fatigue is really an underappreciated problem that many people are having. How do we test? So the question would be, you come in, you have symptoms, you're tired, and you're more tired than maybe you've ever been in your life. So we would have you do blood testing for thyroid, and I have people do with a 24-hour urinary hormone test because it's really the most effective way to see cortisone and cortisol levels. I don't particularly like a spot blood testing for cortisol. And then one that I didn't put in this particular part, if you really feel your adrenals are off, a 4-point cortisol is useful in saliva, and I may refer to it later on. But what that is you take a saliva sample at 8 a.m., noon, 4 p.m., and 8 p.m. You can do other combinations as well, but those are typical. So a typical curve related to cortisol, and that's what we're talking about when we're talking about adrenals. What wakes us up in the morning at 8 a.m. or sooner is the rise in cortisol. And then it starts to fall naturally throughout the day to where it's almost at its lowest ebb, not quite at its lowest ebb at the end of the day, that then propels us to sleep. The lowest ebb, the most dangerous time to be on the road is at 3 a.m. So if you can avoid driving at 3 a.m., have you ever wondered, like, no one's on the road and there's an accident in the middle of the night? It's because the cortisol is low and you're supposed to be sleeping. So also that rise in cortisol that often has been attributed to heart attacks Monday morning as the cortisol comes up. So, but I have seen weird presentations where the cortisol is high at 8 a.m. and at night, and that's almost always, in my estimation from what I've seen, insomnia. So when it's very high at those times, then oftentimes people can't get to sleep. So this is where giving an accurate picture to your doctor, kind of assessing what's going on, is important for the next steps. So how do you optimize it? And I would say the adrenals, as I said earlier, the adrenals are what you optimize first. But good thyroid function requires a certain amount of cortisol. So you want to look at both of these. And so if the adrenals are not functioning properly, that affects then the thyroid values. And I would say there's no quick way to do either one of these. So in the best case, or let's say if you had this available, the best way to treat the adrenals is actually to take a 3-month vacation. So I can't give that prescription to many people. But it generally takes about 3 months for the adrenals to come back. Everyone's laughing, but it really takes a while for the adrenals to improve. It's an all or nothing sort of a gland. I'll just, you'll know what I mean when I describe it, some of you. We can go, and that's what our society tends to have us do. And you go, and then you get to the edge of the cliff, and you drop. I see people do that all the time. So when you hear people talk about crashes, they're off the cliff. And that's an adrenal crash. And so you've got to catch it before then. But, many professionals, we don't. We go and go and go, and we miss the cues. And it doesn't help that, I'm glad we do, but it doesn't help that we can leave the lights on all night and, we don't get the normal cues about going to sleep and resting. But the adrenal is the original, I need to rest gland. It really is. Thyroid is a little bit more forgiving, and we have a bit more specific therapies for it. It generally takes about 6 weeks, though, for the thyroid to come up to level. And then I don't test any more often than every 3 months. So let's go to the next slide. So which is it? And this I'll ask you if you have a question. And let's say it's been ambiguous on testing, or your doctor, doesn't even look at it. So both adrenal and thyroid, you gain weight, but in different ways, depending on how severe the problem is. There's a puffiness to thyroid. There are some classic pictures, if you look at them, the before and after. So before giving somebody thyroid, they look a certain way. After it, they often look like they lost weight. The face just slims, the body slims. And when I talk to people, I ask them, do you have edema around the ankles, puffiness anywhere, the hands? I'll often see that as an issue. You'll see coarse, dry hair in people with thyroid issues. Nail issues will come up all the time. Poor healing. And many people that are low thyroid will actually be sick all the time. So infections are very common. Similar when you look at the adrenals, so you can see how you probably, can't tell the difference. I speak of an adrenal type in some cases, people who are chronically low. Oftentimes they have very low blood pressure, they're very thin, and in terms of using aldosterone, it's been most effective in treating people with low adrenals. And it makes sense because aldosterone is actually an adrenal hormone. So it's not universal. I really wish it was, but it isn't universal. So for the next...
Is there any natural supplement for aldosterone? Food supplement or...
So the question is there a natural aldosterone supplement? Kind of the history of aldosterone is the natural source of aldosterone. So the original thing that was used in terms of hearing loss was actually prednisone. So it's a non-natural anti-inflammatory. But that's what was being used for sudden sensorineural hearing loss. So Dr. Dennis Troon back in 2000 and several other investigators looked into it, and they wanted a natural supplement in the body that they could replace aldosterone, prednisone with, because it has so many side effects. And so aldosterone is the supplement. Now, if you're talking about hearing loss, I don't know another one that it is effective. And I guess the simple answer is right now I don't know of a better alternative for that. Yes, ma'am?
You spoke of supplementation of zinc and copper amino acid therapy for improving testosterone or HGH. Is there any kind of supplement that, again, helps that hormone the same way, aldosterone?
So the question was, people are paying good attention. You can quote back to me the supplements. That's good. So I mentioned things about raising growth hormone, raising testosterone. Is there something that raises aldosterone? In a sense, it's what I'm talking about now, improving adrenal function. I have to say, in terms of my studies, I did not go to that direction because in most cases what we did is we tested and we saw that the adrenal production of aldosterone was low already, so that we gave it. The body produces about 400 micrograms of aldosterone a day naturally. So, and so when we were doing this for hearing loss, we were supplementing with 250, we're still doing it, 250 micrograms a day. So in terms of testing, we needed a very low number. But salt and stress have an impact on aldosterone production as well. So I mean it in the sense of reducing stress on the body, reducing inflammation, and sometimes watching your salt intake. So it's very receptive to salt and the use of salt. So anyone else? I should have had this titled aldosterone today. So anyone other questions on adrenals? I'm going to still talk more about them. So again, more about is it adrenal or thyroid. And I love this rule of thumb because it's so clear when I'm asking patients. So ask yourself now, when you exercise, does it make you feel good? Are you motivated? If exercise makes you feel worse, then you have an adrenal issue. And you need to support your adrenals. If thyroid, however, exercise makes you feel good. So even with a low thyroid, you can exercise and do an exercise program. But most people with adrenals, if I say, can you exercise, the answer is no. Sometimes I can't even get out of bed. So adrenal is more dramatic. Thyroid, again, probably less so. So Hans Selye, and I won't go into this a lot, he came up with the 3 stages of adrenal compromise. And he said initially, in terms of the alarm reaction, the fight or flight is, how do I want to say it? Fight or flight is really our reaction. Let's say we're running away from a bear in the woods. So we hope we never encounter one. But that's what happens with the alarm reaction. Every adrenaline kicks in, we run away. That's a normal response. But in our society today, we're running away from bears in the form of people driving, all things that are out there, even the stresses in our businesses, our lives, our family. We're always under stress. Now, you need stress. You need positive stress even to live. But over time, it affects the immune system. It affects how you function. So what we see in terms of testing, we will see the cortisol levels go up, and we'll see other things go down. As the body then adapts to the stressors, we are all adapted to some degree to stressors, we start to see the numbers decline, but they still look good on testing. So then, going to the next slide, Stage 3, exhaustion. This is when the numbers plummet. We start to see very low numbers on testing. And then other things occur. We see poor wound healing. I see poor ability to cope. And I'll give you an example of what an adrenal response is, somebody that's adrenally compromised. And I had one patient tell me, birds singing really bother me. He couldn't stand the sound of birds. Even a child's voice that normally they might find pleasant in the other room was like, oh, I can't stand to hear that, or neighbors. And I'm convinced some fights between people erupt because of adrenal stress. They just can't stand what that person is doing. Under balanced circumstances, they might not react that way. Even road rage, examples of people really out of balance in terms of adrenal function. So you will see these types of things occurring, and you will see some of these results that are occurring as well. I'm not saying chronic fatigue causes mercury toxicity, but it's already there and is being exacerbated by the state of adrenal dysfunction. So how do you treat it? There are a lot of ways to do it, so I'm not going to say there's only one. I use adrenal glandulars a lot, bovine types, that help support the adrenal cortex itself. I want to caution people about licorice. Licorice is definitely an adrenal support, but you have to make sure you have a lot more cortisone, which is the storage hormone for the adrenals, than cortisol. If not, what happens is you block the conversion of cortisol to the storage hormone, and that can lead you to further exhaustion. So you want to use licorice carefully. It's definitely a good support, but don't use it in inappropriate ways. And the best way to know that is to do testing and look at it. Exercise, if a person can do it, absolutely helps support the adrenals. The B vitamins are very important to supporting it. And I like to use a combination, and I'm actually referring more to my mitochondrial deficit here, but it's part of the whole process. I like vitamin B12 folic acid, and there's one that Dr. Wright put together that is wonderful, and it tastes good too. You don't always get a lot of good tasting supplements. And CoQ10. CoQ10 is very helpful at supporting energy on a deep level. Vitamin C is actually the first line of defense in supporting the adrenals, anywhere between 2,000 and 3,000 milligrams per day. But you do want to be careful because it also has an effect on bowels. So too much vitamin C can lead to diarrhea. But I would say that's more likely if you're using both vitamin C and magnesium together. But use it carefully because it is actually a good adrenal support. I mentioned the hormones earlier. They do help, especially DHEA and testosterone. Essential fatty acids reduce inflammation and therefore help support the adrenals. Ashwagandha and ginseng, you will find them in different formulas designed for the adrenals. In one of the handouts, I think it's the one that hopefully that everybody got, the list from Dr. Wilson. He listed, I don't think I have it here, he listed a tonic to use in the afternoon. And at the very bottom it says do these things. He said take 1,000 milligrams of vitamin C complex with 200 milligrams of magnesium and pantothenic acid at about 2 p.m. every day with a small snack to help avoid the 3 to 4 p.m. low. So that's one thing you can do too. Pantothenic acid is also great for supporting the adrenals. The only thing I want to caution you about is that sometimes gluten can cause that afternoon low. So be careful you're not actually seeing a food allergy reaction. So even though I'm speaking of these things, I'm also suggesting too that you evaluate other causes. Look at food allergies. Look at other things that could be impacting what's going on. And that's where when you talk with somebody who knows about these kinds of things, they can help to take you through those steps and identify it. So if the adrenal compromise is more severe, that would be the next one, then you want to consider things like hydrocortisone or supplemental cortisol. And I would say cortisol, and I order it compounded through a compounding pharmacy, so it's bioidentical. And it will help to rest the adrenal gland if the deficiency is really severe. Or let's say you have Addison's disease, which is more of an autoimmune state of low adrenal function. You want to eliminate stressors. I know it's harder to do. You can't just say it. It takes focusing on how to do things differently. I've had people make dietary changes, and especially with reducing things like sugars, carbohydrates, which can take the stress off the adrenal glands. And then I mentioned the vacation, time to rest or recover. It doesn't have to be 3 months at a time. It could be an hour a day where you're actually paying attention to certain lifestyle factors. And I mentioned earlier the mitochondrial dysfunction, the CoQ10, D-ribose, active B12 folate are very helpful in those particular circumstances. So the thyroid, let me first say the adrenals are actually, you have two of them, they're on top of the kidneys, more or less what we call retroperitoneal in the back. They're small, so thyroid gland also small in the front of the neck. Basically, if anybody has ever palpated your thyroid, they have you swallow, see whether that moves, see if there's anything they can palpate there. It's shaped like a butterfly. There are two lobes with a middle, wraps around the trachea. Sometimes what can happen is if there is a thyroid problem, people will develop a goiter or a growth of tissue. Sometimes, I do have a number of patients that have had thyroid cancer, and they do very well with adding in thyroid hormone. So it basically is what helps you have energy through the day. It helps support the basal metabolic rate of the body. And one of the most overt symptoms of it is fatigue, but there are many other symptoms that occur with it, and some of them overlap with what we would consider other diseases. In the next slide. So these are the most common symptoms. Is there a question? Yes, sir.
If you have a goiter, what would they do for that?
So the question is, if you have a goiter, what would you do? It depends, I would say, on what the testing reveals. Typically, what I often will do is add in iodine. So you probably heard about in the past the goiter belt was an area around the Great Lakes where there was very low amounts of iodine that was in the soil. Iodine blows in from the sea into the soil, so there may be natural areas where iodine is high, but it was low in that area. So that's how we got to adding iodine to salt to reduce the incidence of goiter. So iodine can take that down. Yes, sir.
And I've heard, tell me if this is true, that fluoride in the water competes against iodine, kind of interferes.
I think so. The question I think was fluoride. Fluorine competes. Yes, it does. So fluorine, chlorine, bromine, iodine are halogens. We actually do a test here that looks at your halogen levels. Chlorine obviously is in our water. Fluorine's in our water for teeth or reducing dental issues. Iodine, it's not so much an iodized salt anymore. I mean, it is an iodized salt, but nobody's using it. Everyone comes in and tells me I'm using pink Himalayan sea salt, which is great. It's not being used in bread anymore. What they're using is bromine, because bromine makes bread fluffier. And so iodine is disappearing from everything. So we will do this urinary halide testing. We have people test and see what the levels are to know whether you need to add iodine back in. Iodine, I consider a wonderful mineral, important for breast health, uterine health, the thyroid, many other situations. So, but we're not getting, and this doesn't mean everybody go out now and pour tons of salt on your food. You have to be careful of things like blood pressure, but we're not getting much. And if you're wondering, you can have an iodine loading test done and look at it. So long as you're not allergic to it, there is a certain percentage of the population that is allergic to it. And some people who shouldn't use it, let's say they are euthyroid, meaning they're not hypothyroid, and in those cases they shouldn't use it. Or somebody that might have what we call autoimmune thyroiditis, in which case iodine can sometimes stimulate a thyroid storm. So there are times when you shouldn't use iodine. Question again, sir?
I didn't catch it. You said fluoride, bromine.
Fluorine, chlorine, bromine, and iodine.
And what are they?
Halogens.
Thank you.
And so they can, you are correct that bromine, fluorine, chlorine can reduce levels of the others. And adding iodine in can actually help restore balance. So these are low thyroid symptoms. It's not exclusive, but low. Constipation, a big one. When people report constipation, I test. High cholesterol is a symptom related to thyroid in many cases. Fatigue, obviously, but joint pain. So, and many people, both with adrenals and thyroid, are cold. I often, in my office, my most common exam is I look at the nails and I feel the core temperature. And I have so many people that are chilled to the bone, maybe even people in the room that are so cold it penetrates through them to me. That's how cold they are. That's adrenal or thyroid issue. There could be other causes, but that's one symptom that I see. Low immune function, too, with low thyroid. People get sick a lot when their thyroid isn't functioning. And so going to the next one, I'll just say briefly, there are actually, from what I understand, there are 12 types of thyroid, apparently to a doctor named Dr. Leslie DeGroot. I don't have all of those listed here, but the most common we know of are T4 and T3. The body will naturally produce T4 and T3. T4 is converted to T3, which is the biologically active thyroid. And that's why we need iodine, because iodine, as it's cleaved off of the iodine molecule, it becomes, goes from T4 to T3, and it's recycled back to create T4. We also have T1 and T2. These aren't known or measured, but they're important because they form these other molecules. So if you have too little thyroid hormone produced, then you're hypothyroid. If too much, you're hyperthyroid. And going to the next slide. So how do we assess it? I prefer, hands down, blood testing. And then I've had many people come in, and I wanted to be very clear on this test, because there are so many people that don't measure all these things. And I don't know how to evaluate thyroid without doing these things. So TSH, the thyroid stimulating hormone, is the command from the hypothalamus to the pituitary to the thyroid. So it says, okay, body, we need more thyroid. We don't have enough. So it's sending the signal so that the body responds, produces T4. T4 is converted to T3 out in the body. And so that's all well and good. It's a negative feedback loop. So when you get enough, the TSH stops circulating. But if it's not producing, not acting well, then it'll keep rising. I've seen TSH should be, let's say, in the range of anywhere between 1 and 5. And I'm not giving you the reference ranges we use. We use smaller reference ranges. I've seen them as high as 20. I actually have a patient who has an autoimmune state who's got numbers far in excess of that. So oftentimes when it's that high, we're looking at the autoimmune state. You want to measure the free T4 and the free T3 because that tells us how much T4 and T3 is circulating in the body. The TSH is not enough to tell you that. So the reverse T3 is actually the conversion. So normally free T4 converts to T3. When that mechanism is affected by inflammation, by heavy metals, other issues, it goes to what we call reverse T3, which is a mirror image, not biologically active version of T3. So you will see that number rising if that conversion is not working. Thyroid antibodies will tell us whether it's autoimmune, And TSI antibodies are an antibody estimate, evaluation that tells me about Graves' disease. So it tells us how much your body is producing and how much it's using. So, and I said earlier, it's not enough just to do a TSH. Yes, where? I'm sorry. Sure.
Before you said that you use a 24-hour urine test because it gives you a better look rather than just one point in time. So are you saying that T4 and T3 levels don't fluctuate that much over time?
So the question is, I advocated strongly for a 24-hour urine because it gives me 24 hours. And in blood, I'm saying one point in time, and the answer is actually yes, getting to a level. Now it'll fluctuate during the day, different times of the day. We're not going to be measuring at 8 a.m., noon, 4 p.m., that kind of thing. Everything will vary. There's not one level throughout the day for anything in the body, but it's not going to fluctuate to the degree that other values will. So I'm going to be able to get an accurate measurement. So for example, if you take your thyroid in the morning at 7 a.m., at 8 a.m. the number is higher, relatively speaking, than it's going to be at 4 p.m. So a good point here to make is T3 has an half-life in the body of about 8 hours. So if you take it at 8 a.m., by 4 p.m. it's going to be coming out of the body. That's important because T3 is the biologically active molecule. T4, on the other hand, has a half-life of 7 days. So you take T4 every day for 7 days, then you're going to be to a higher loading dose. So looking at half-lives, it takes about 6 weeks taking thyroid medication to get you to where you're at a dose that's effective. So I don't measure, though, at 6 weeks. I wait 3 months to see what that average dose is of T4 and T3. Does that make sense? So it takes a while in terms of half-lives of getting you to the right level on thyroid hormone. So I can't have you take thyroid today and measure it tomorrow and be able to know if that's helping you. It won't show very well. But that's why to use the blood. Now, we do have the 24-hour urine that does have T4 and T3 on it. I just personally don't find it a very effective tool the way it is, and I personally prefer blood. So we'll go to the next one. Was there another question I saw? So conventional treatments tend to be the synthetics. Not to go into or express opinions about them, Synthroid, levothyroxine are the most common ones you've heard of. Synthroid is just T4, so that leaves out T3, T2, T1. In people that, let's say, have a certain need for just that, let's say autoimmune thyroiditis, then that's the way to go. But there was a time about 4 years ago when Armour Thyroid was going to natural desiccated thyroid, they were going to revise their formula. They've been on the market for 100 years, and they were going to revise after that. FDA made them shut down. We couldn't get, Nature Thyroid, Armour Thyroid. All we could do was either get T3, T4 on ice, shipped to compounding pharmacies, or use the synthetics. During that time, we had so many people that were so sick. They were either underdose, overdose. They felt terrible because people do better on a balance of T4 and T3. I will say, though, there are times you have to use it. Not everybody can do just one thing. So the other way of also supporting the thyroid synthetically is Cytomel or synthetic T3. So here's basically the discussion on using natural thyroid. We found that people feel better on a combination of T4 and T3. It seems to be more effectively converted. The body contains more T4 than T3, and so the natural desiccated thyroids contain a certain effective balance. Any questions on thyroid? I'm going quickly through it because it's really just about the dosing there. Important cofactors, I already mentioned iodine. Tyrosine is a precursor to thyroid. Selenium is very helpful in tonifying the thyroid. It's very useful in the autoimmune thyroid state. Vitamin A, zinc and copper and iron, and many people also talk about using vitamin K with it. Any questions on thyroid? Good. We're either answering the questions or I've confused you totally. So let's talk about brain health now. Now, I'm going to refer more to Alzheimer's here, but it doesn't mean it's the only kind of dementia. You can have mild cognitive decline and it's not Alzheimer's. It doesn't necessarily have to progress. You can have other forms of vascular dementia that are occurring. But by 2015, it's really estimated that as many as 1 in 3 or even 1 in 2 people will have Alzheimer's disease. And it's not only is expensive to treat, it's devastating on families and individuals. So I'm optimistic, and I'll show you why in a minute. I think we're going to get a handle on it. I think we're beginning to understand it. The other thing to know, too, about some of these problems is that it affects the lifespan. From beginning to death, the average length of time somebody has Alzheimer's is about 12 years. So it effectively reduces the lifespan of somebody. That isn't universal, but as it progresses, people forget even how to eat, and certain other functions stop working as well. So going on to the next slide, can it be reversed? Now, when I did this talk, or a similar talk, some time back, and I go to the Alzheimer's conventions every year and have done it locally since 2009. Many people were talking about these pathologic changes were irreversible. People are starting to talk about reversibility, and I don't know if you looked in any of the internet feed yesterday or not, they're actually talking about the study I'm going to mention. We've been talking about it here at the clinic for many months, and we even did an article in Dr. Wright's newsletter, Nutrition and Healing, which is no longer available, by the way, some time ago. So there is discussion now, reason for optimism about reversing it. But when we're looking at brain health, this is why I'm saying to people here is you have to be thinking now. You don't want to wait till you're 80. You got to be thinking now about brain health. And even if you're 80, you can still think about improving brain health. There's a wonderful book by a gentleman, Dr. Snowden, who did the nurses study, nuns study. So this was some years back. He decided to study Alzheimer's progression in nuns because it was a captive audience. And he essentially interviewed, cataloged the lives of all the women in this particular order. And it was a longitudinal study, so it went on for many years, and it's still going on, but not with him as the head any longer. And so he definitely showed on autopsy, because that used to be the only way you could identify Alzheimer's disease, that many of the nuns had progressed to Alzheimer's. But did all of them show it? They didn't. There was even one nun that came in at the age of 70, and she actually began an exercise program at age 70, and never showed any mental decline. And when they looked at her brain, then they did the autopsy, they had plaques and tangles everywhere. So it shows that these pathologic changes, in some cases, are not directly correlated to symptoms. So that's why I'm very optimistic at what we're seeing, and I think we don't totally understand what's going on. Now, when I say 80 average age of onset, that doesn't include the early onset, the familial types that might come in at about age 40 and 50. Yes, did you have a question?
Is the bioidentical hormones, can they slow this down or reverse it?
So I want to direct your attention to the thing that's called therapeutic systems. So This is a list. It's actually 36 items. There's really only 24 listed here, but there's a total of 36. The bioidentical hormones are part of the picture. I don't want to say they're the only part. This is very technical, and I'm also not telling all of you to go on everything that's on this list. It'd be too hard. But the bioidentical hormones are important for reversing cognitive decline. If we could go to the next slide. So this is what I was talking about, the neurofibrillary tangles, amyloid beta, that have been identified in the brains of people with cognitive decline. So there are many proposed reasons for this, but oxidation, inflammation, some of the things we've already been talking about are factors. So let's go to the next one. This is a study that was done by Dr. Bredesen at UCLA. And he and his team pulled together 10 people with varying stages of cognitive decline. So there are different stages from subjective, meaning nobody else can say that you're declining, but you feel like you are. You get a lot of people that come in and say, I can't remember anything. You know, if it wasn't for my partner, I wouldn't know where I lived. And so some of that is really not Alzheimer's. Some of it is just the perception of it. But subjective observation is relevant. Some had mild cognitive decline where there are various conditions that are associated with it. One of the first things you see with cognitive decline is people having difficulty with finances, for example. And I'm not talking you can't find your keys in the morning, or you misplace someone's phone number, or you can't remember your friend's name. I'm talking about much more serious things like that that are going on, like you no longer remember your children's names, or you don't know how the way to go to work anymore, or things like that. So some of the participants in this study were unable to go to work because they had such decline. Some had to stop doing the things they loved to do. So there was only one that would have been considered to be late-stage Alzheimer's. Everybody else was between mild decline and Alzheimer's. Yes, sir?
Do concussions affect cognitive?
So the question is, do concussions affect cognitive decline? I haven't been going into brain trauma here, but yes, different things that cause brain trauma, from frequent concussions, chronic traumatic encephalopathy, CTE, that's been associated with football players, for example, is an example of, concussions and damage to the brain. So brain bleeds, for example, somebody that is let's say has high blood pressure, and so the vessels are having little bleeds here and there. Stroke, for example, is a risk factor for cognitive decline. In a sense, managing trauma and managing your numbers is what you have to do to support brain health. So yes, concussions can contribute to cognitive decline. It doesn't mean they have to. Not everybody that played football or other sports has chronic traumatic encephalopathy, but many do. And I heard one study, the gentleman who identified it, who said he thinks 100% of football players have it. They just haven't exhibited it yet. So things that affect the brain but also affect the body, like type 2 diabetes, is a risk factor for cognitive decline. So many different things, and that's what this list addresses, is how to manage them, what things to pay attention to. And I will say it is very technical. So going to the next. This is the important thing to know, is each participant wasn't asked to do all 36 things. They were given a choice of what they wanted to do. One case study involved a woman who went on hormones. She elected to modify her diet, with a diet with healthy whole foods, organic fruits and vegetables, organic, what am I trying to say? is meats that are organic, not avoiding processed foods, things like that. Wild-caught fish, salmon. And the other thing she chose to do was to fast for 12 hours. So let's say she had dinner at 7. She didn't eat again for another 12 hours. And she didn't eat for 3 hours before going to bed. She managed caloric intake. She managed her numbers, engaged in certain degrees of brain stimulation. This particular woman chose to do yoga and also exercise, and there are recommendations for exercise. And then the study length was between 3 and 6 months. And this is significant. This is the first one to show this. 9 of the 10 people showed improvement in cognitive function. And it wasn't just subjective, it was measured. They did the cognitive testing, they were standardized, and they could show improvement in all but the one patient that had developed late-stage Alzheimer's. It's phenomenal. I mean, this should have set the world on fire, and it's only just now coming out. Probably some of the most incredible information I've ever seen. I'm not surprised, though, because in this building, we've been talking about these things forever. It's now gotten to a place where a study that could be conducted at UCLA and recognized was done and proved that all these things that many of you are already doing are helpful. I didn't write it down, I have an online book produced under the Practicos website, and I wrote it, I began it in 2009 and it was published online in 2012. So, which incorporates a lot of these different ideas. So these were out there already. So I want to say, have hope for yourself. I think even hope for the world. So let's go to the next slide. So here are some of the successful components. It's interesting. When I looked at it and I looked at, okay, what can I do right away? Dental care. And not that I was bad at it, I was good at it, but flossing every day. So taking good care of your teeth, flossing daily is one of these things that they recommend. And part of the reason is it prevents bacteria from and inflammation, and it can also prevent heart-related inflammation as well. So good dental care, preventing type 2 diabetes, maintaining blood pressure at a good level. We talked already treating hypothyroidism, adrenals, optimizing weight and diet, reducing stress, getting a good night's sleep. These are things we've been talking about in the holistic community forever. So are they revolutionary? They are, in the sense of there isn't going to be a drug. And at this last conference, everybody said it. No drug is coming to the rescue of Alzheimer's anytime soon. It is not happening. Now, they may be looking at other ways to modify it, but the way to do this is to reduce the insults on the body. Pick up a good exercise program, manage the numbers, stay mentally and physically active. Now, I'm not actually advocating his products, but Gary Small was the keynote speaker, and he was talking about the many different ways of mentally stimulating, from doing crosswords to Sudoku or to testing. I've gone online myself and tried some of these different things, and I'm shocked at how rusty, but then you get going after a while and your reflexes improve. I can't do a crossword puzzle to save my life. It's harder than it looks. So you all may be whizzes at it, but so he advocates doing a different thing every day to keep your brain stimulated. Not just getting good at one thing. It's not the getting good at it. It's keeping the brain stimulated that is important, and remaining physically active. Supplements. I know you're probably wondering. I will say Dr. Wright did formulate something called Sage Memories that includes lithium, niacinamide, turmeric, rosemary, and sage. And so these are helpful in supporting brain health, but they can also be taken separately. I didn't give you doses because I don't really want everybody to just go put themselves on all these things. There are reasons not to do that too. Lithium, when I'm talking about lithium, I'm not talking about high doses like for bipolar disorder. I'm talking little tiny amounts. But there is good evidence on some of these for resveratrol, fish oils, that's EPA, DHA. I mentioned the pantothenic acid, coconut oil, Magmine, that's the magnesium L-threonate, just a few. And some of them are also mentioned on here. Again, don't spend your mortgage in supplements. So make selected choices. Niacinamide does penetrate the blood-brain barrier, though. So that one does get and is neuroprotective. For me, I was actually on a very low dose of lithium, like 5 milligrams, when I had my stroke. And I think that's partly why I was protected neurologically. I still have deficits that affected the right side, but I think I bounced back much more quickly. And the neurologist I worked with, it was almost like he had to whisper it to me. He said, I would give lithium to more people myself if I could get away with it, if my colleagues didn't object to it. So anyway, so he recognized neuroprotective again and neuroregenerative. That's why I like also B12. It has a neuroregenerative component to it also. So there are things to do that are supportive when we're talking about a good brain health program. Yes, sir?
What is Sage Memories of Bacopa?
So Sage Memories is Dr. Wright's product that contains lithium, niacinamide, turmeric. It's a specific dose, 4 capsules a day. Bacopa, it's interesting. I have Bacopa in my garden. It's a small little plant that has shown benefits. We don't use the one that we grow as an ornamental, but it has shown benefits in terms of brain health. There's also lion's mane, which is a type of mushroom that is helpful. Good studies, and also a jellyfish. Aquarin is the name of that one, that have shown good benefit as well. So, I mean, you could take 100 things, but you want to come together with the right combination. And so kind of what I'm talking about is how to pay attention to your symptoms, optimize, improve your health for healthy living and brain function. I did mention food allergies, stimulating the mind, get a good routine, eliminating body burden. I'm talking there about heavy metals, which we didn't go into much. We didn't talk digestion either, but I believe in the knee bones connected to the thigh bone. The digestion is the key to everything. So you could take 100 supplements, but if you can't digest them, then you just have expensive urine, right? So, and take time, and that's what Dr. Wilson is kind of saying in this list. Take time to relax and appreciate, all the bounty that we have available. And I think the next slide is the end. Any comments before I wrap anything up? Anything anyone would like to know or say or do? Yes, ma'am.
I was curious about, this was from earlier, but when we were talking about bioidentical hormones, if a person is on conventional birth control pills to regulate their periods and also a antidepressant, do those things have to be eliminated before they can do bioidentical hormones, or is it possible to do both, or?
So good question, very good question. The question was, if you're already on birth control pills for regulating the cycle and maybe an antidepressant, can you use bioidenticals? It comes down to, again, the why for those. So if a person is at the same time trying to prevent pregnancy, then you do not want to add more hormones in. That'll nullify the birth control aspect of those pills. So, I mean, unless you had other sorts of methods or were beyond that age. So it's not inconceivable to be even, let's say, 40 or 50 and needing to regulate. But at a young age, you would lose the benefit of one of those benefits. So the answer is yes. I have put young women on progesterone, for example, that really does help regulate cycles and other sorts of things that regulate PMS. With mixed results, it's not always effective. Then again, birth control pills are not for everyone either. They do increase your risk of blood clotting. So you have to evaluate that. But so the answer is yes, and also it depends. Just like everything, it's a balance. So yes, sir.
Are there any websites you can recommend that are dedicated to optimizing mental function, cognitive function?
It's a good question. The question was, are there good websites to recommend? Are you the kind that likes to read stuff? Could you read a scientific paper? You know, what I might recommend first would be to look at the study. You did already?
Study, yeah.
You did already. You know, it's a good question off the top of my head. I know they're out there. I just I can't tell you right at the moment. If you want, I can get back to you and suggest. But right at the top, I can't. I look at so many things. There isn't just one I go to. Probably you do the same. Anything?
Always looking for good ideas.
Yeah. I can ask that tomorrow, maybe in our doctor's meeting, or about websites on brain health in general,
Yeah,
or
improve to optimize cognitive
Optimum.
function, yeah.
Okay. Any comments you want to offer the group on the Bredesen study? Anything you would add from that? Yeah. Any other comments or thoughts or? Well, I think we'll wrap it up. I will be around for a little while. Longest night of the year, or one of them. Thank you all.